The objectives of the current European Health Data Space Regulations proposal are broad and ambitious and arise from the improvement areas highlighted by the COVID-19 pandemic. Those objectives are mainly to, first, empower EU individuals through a better digital access and sharing of their personal health data, while ensuring a greater control and protection. Two, to allow health professionals and policymakers to have an easier and more effective access to health data. Three, to increase the interoperability to support health data exchange between healthcare providers. And finally, to facilitate the access to non-identifiable health data for researchers.
As the scope of the regulation goes hand in hand with its objectives, the regulation will directly concern manufacturers and suppliers of electronic health record systems and other medical or wellness applications, controllers and processors established in the EU processing electronic health data of EU citizens or third country nationals residing in the EU, such as health professionals, healthcare providers or researchers, and more largely any data users to whom electronic health data can be made available by data holders in the EU.
With respect to the primary use of electronic health data, which covers the provision of healthcare services, the regulation will namely 1. Strengthen the rights of individuals over the data by, to a certain extent, complementing the GDPR. 2. Create the My Health at EU platform, which will facilitate the exchanges of electronic health data among national contact points for digital health. Or 3. Impose specific obligations on economic operators such as manufacturers, importers, and distributors of electronic health record systems and wellness applications.
With respect to the secondary use of electronic health data, which covers research, innovation, and policy-making purposes, the regulation details the conditions in which such secondary use can be carried out. To that aim, the regulation requires member states to designate health data access bodies, which will namely be responsible for granting access permits to data users making such requests. And Health Data at EU platform will also be created to facilitate cross-border access to health data for secondary use, and third countries or international organizations could also become authorized participants to such platform where they comply with the requirements of the regulation.
The best way to illustrate the progress that the regulation intends to bring are practical examples. The first example would be a Luxembourg national living in Germany but getting sick during his or her holidays in France. Thanks to the regulation and the My Health at EU platform, the French doctor consulted will be able to access in French the medical history on his or her computer. The prescription issued by this doctor could then directly be accessed by a French, German, or Luxembourg pharmacy in an electronic format.
The regulation could also be of crucial importance for a tech company developing an AI-based software supporting doctors for diagnostic and treatment decisions. The AI will need to compare the patient's information with the information of many previous patients. To help training the AI algorithm, the regulation would allow the tech company to have an efficient and secured access to a huge data pool.
As the European Health Data Space Regulation has only been published in early May 2022 and may still evolve following future discussions, it is too early to advance the date of entry into force at this stage.